It's a global mystery, hundreds of unexplained cases of hepatitis in children in less than a year. The Hospital for Sick Children in Toronto has identified 7 probable cases.
Large children's hospitals regularly but rarely see children with severe hepatitis or inflammation of the liver. The parents don't know.
The hospital's chief of infectious diseases says there don't seem to be more cases than usual.
But it is really important, though, for us to move forward and carefully evaluate these cases and any new cases.
In case they're linked to a global outbreak, federal officials will also be investigating. Beyond Canada, cases are being reported in more than 20 countries, including the United States, Israel, throughout Europe, and in Japan. So far, at least 5 children have died, and more than 24 needed liver transplants. Just last week, American toddler Balin Schwab was one of them at a hospital in Minnesota.
And it's like you sit here and think, like, there's 100 cases, why my kid?
It's all prompting some major questions.
Why now, and why, in the context of certain countries, not others, the context of certain time frames and not others.
Questions the World Health Organization is racing to answer.
The leading hypotheses remain those which involve adenovirus, but I think with also still an important consideration about the role of COVID as well, either as a co-infection or as a past infection.
The viruses behind COVID and the common cold can cause liver injuries, sometimes even late into an infection.
It may be what you did 6 weeks ago or even a couple months ago, and that becomes much harder to tease apart.
Sick Kids is now storing patient samples, and scientists abroad are conducting serological testing to see if patients had antibodies from prior infections.
We are still early in the phase of the investigation. I would not want parents to be alarmed. This is very rare.
So, Lauren, clearly, this is very rare, but still, this is very concerning for parents. What are the next steps in figuring out what on earth is going on here?
Well, global investigation teams need to see if there is a clear trend, a clear spike in cases. If there is, there could be multiple factors at play. Is this something to do with a virus, or is it environmental, a toxin, some other pathogen, or some combination of factors? Now, researchers we have spoken to say they are hopeful we'll figure out this medical mystery.
Lots of people are counting on that. Lauren Pelly, thank you. For more on this, I'm joined by Dr. Cora Constantescu, a pediatric infectious disease specialist from the University of Calgary. I have so many questions for you. I'm just imagining, given how fresh this conversation is, what are the questions you have?
So many things we're thinking about. First of all, how big of a deal is it? What's the actual burden of it? We know that 10 to 15% of the kids end up with liver transplants, but how many end up with hepatitis once they get infected? So what's that denominator? And what's really causing it? And how do we best manage it and test for it and treat it? And once we know what it's caused by, how can we prevent it? Can we get a vaccine for it? All these are questions that people are working very hard to answer.
Okay, so there's a lot there and a lot of caveats and cautions. Obviously, this is still extremely rare. But if you're a parent right now, though, you still want to know what to watch for and when to act. What would you say?
I'm a parent of 3 kids, 10 and under myself, so I'm watching this very carefully. There seems to be some association of this hepatitis with presentation of gut infection, so nausea, vomiting. If at any point the kids end up to the point where they cannot keep any fluid down, you cannot get fluid back into them because they're vomiting and having diarrhea, you need to go in and have that child assessed. At the same time, when you have kids with white stools or really dark urine or a jaundice or yellowing of the skin, those are all signs that this could be hepatitis and the kid should be brought in.
All right, important information. Doctor, thank you very much.
Thank you for having me.